Hi, I'm Josh with Dynamic Defense Solutions. Today we'll be talking about airway management in the pre-hospital setting, and specifically opening the airway. The first step to managing the airway in the pre-hospital setting is to open the airway to allow the most effective breathing and check for airway obstructions. The most effective way to open a patient's airway is a maneuver called the head tilt chin lift. If no head or neck injury is suspected, then the head tilt chin lift is the best way to open and manage the airway. Let's go over the steps of the head tilt chin lift. Place a hand firmly on the patient's forehead with the palm to tilt the head back. Place the fingertips of the other hand under the lower jaw to bring the chin forward. Be careful not to apply pressure on the soft tissue under the jaw. Tilt the head back and bring the jaw forward in a simultaneous motion. If needed, use the thumb to pull down the lower lip to help open the patient's mouth. Visually and physically check the airway. If there are any obstructions caused by foreign objects, remove them by sweeping your finger along the outside of the patient's mouth, being careful not to obstruct the airway further. If there is pooled blood, vomit, or other fluids in the patient's mouth, place the patient in recovery position to help drain, maintaining the airway. If a head or neck injury is suspected, use the jaw thrust maneuver to open the airway without moving the patient's spine. This technique involves less movement and still opens the airway, allowing for more effective breathing as well as visual inspection. Let's go over the steps of performing the jaw thrust. Kneel behind the patient over the head with arms in line with the patient's body. Grasp the patient's jaw just below the ears, placing the index fingers on the side of the patient's jaw. Apply firm but gentle pressure to displace the jaw forward and upward. Use your thumb to open the patient's mouth if necessary. If possible, hold C-spine stabilization in this position, monitoring the patient's airway. And those are the basics for managing and opening the airway. If you have any other questions or comments, feel free to reach out. Thanks.